Warm greetings to all our viewers. Let me introduce this young man, a footballer, budding footballer, Nirvaan. He's 15 years old, and Nirvaan came to us with the diagnosis of pilonidal sinus. Nirvaan, you yourself, he studies in Walham School, Dehradun. You tell us, what do you know about pilonidal? What's your problem? What was your problem? And what did we do? Let's see, hear from you.
Uh, the problem started from I was doing crunches and
Okay.
I suddenly felt pain on my lower back near the tailbone. So
Okay.
I went to my school doctor and he said that it might be pilonidal sinus. So he sent me home and then I came to you and then it was pilonidal sinus only.
And you had an abscess at that time.
Yes,
So
yes,
that's what I always, share with my colleagues, my younger surgeons. They do not operate in the stage when it's an abscess. So I think we gave you some antibiotics for some time,
yes,
and then asked you to report back in 15 days
yes.
time,
In 10 days.
10 days time.
In 10 days.
By then the abscess had settled,
Yes.
and now what was the problem at that time? Now there was no pain at that
There
time.
was no pain when you gave the antibiotics. So after eating that, there was no pain. Like the 10 days, I was totally pain free. But
Yes.
after that, you told me that operation is on this date. So we did the procedure,
Yes.
and now I'm
So
good.
what do you think? What was this sinus? What was it?
It was an ingrown hair,
Ingrown hair,
which has
and they had formed a track
yes,
towards your bone,
yes,
spine.
yes,
And we did an MRI,
yes,
and we found out that there was quite a depth of
yes,
that sinus.
yes.
So what did we tell you? What are we going to do? Did you get scared? Did you understand what
A
are we
little
going to
bit.
do? A little bit.
Handy.
Did we tell you what are we going to do?
You told us. You told that we'll extract the infection out of
We'll
the
remove that tissue, which is
yes,
bad,
yes,
and then
and then we'll fill it up with
fill it up. Because I must have told you that if we remove all this tissue and we close the skin, it's
yes,
like putting a ceiling on a well.
yes,
It'll collapse sometime. So we have to fill the well. So we filled the well. That's called a flap surgery.
flap surgery.
So we took a flap and we rotated it, filled the cavity. It was the
Yes,
largest cavity. I think we showed you the video. Your
yes,
video is on the YouTube.
yes.
We'll link up this podcast with that YouTube.
Okay.
So your surgery is on the YouTube. You might have seen it.
Yes, I've seen it.
Yes. So we filled it up,
Yes.
and you had no problem. You were, I think, in discharge in a day or two, or what?
The next day I was
The
discharged.
next day you went home and you were walking about.
Yes.
Generally, we have stopped you from playing sports.
Yes.
We've said don't go into football, but we've allowed you to walk about, run even,
Hanji.
and jog even.
Hanji.
So you had no pain,
No.
no discomfort,
No.
except that there was a pipe
Yes.
which stayed
That
there
was- yes.
for as long as it was taking out bad fluid.
Yes.
So we kept that, and it was a very thin pipe.
It was a
And
very
you
thin
could-
pipe,
very
Hanji.
thin. You did not feel much discomfort except that you said nikal do.
Hanji.
One day we removed it, and you had an excellent experience, I'm sure.
Yes.
People are scared. Pilonidal sinus surgery is a demanding surgery, but people who are good surgeons, who are good at it, there's no problem. We don't have recurrences. Recurrences happen only for two reasons. One is if we are unable to fill the space, and the second, if we operate in an infected stage. We did not operate in an infected stage. We filled the space, and you're okay.
Yes.
So now you're going to Spain for your football.
Yes.
Wonderful. I congratulate you and I
Thank
wish you
you.
all the best, my dear.
Thank you.